New York's governor confirming the state's first case of that new highly contagious COVID-19 strain that was first spotted in the United Kingdom. The news highlighting the need for a stepped-up vaccination effort across the United States. And joining us right now to talk about the current bottlenecks in distribution and what we can do about it is Michael Osterholm. He is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. He's also a member of President-elect Biden's COVID-19 task force. And thank you for being with us, Michael. Let's talk first about these new strains that we're hearing. We obviously assumed that once we heard about them being in the UK, they would eventually wind up here, too. We've now seen it, I think, in 4 states. How big of a concern is this new strain, just the more highly infectious one?
It's a very big concern, and it's a strain that is obviously around the world, and you're going to find over the days ahead it's in many locations in the United States. And it's the first of what will likely be a number of these strains that are emerging we're at this point in the pandemic.
In the UK, they've actually gone to a pretty tight lockdown as a result. Do you think something like that happens here?
You know, I'm not sure what we'll do here in terms of what's happening. You already have a very serious challenge to what's going on in California, the southern Sunbelt states. And in a sense, we already have a great deal of a number of measures that have been put in place to try to limit transmission. This is a challenge, and it's one that, as we're watching in the European countries with this new variant strain, have been made only more acute by the fact that this virus now, the new strains, are transmitting even more effectively than the ones before.
For a long time, we thought getting enough production of the vaccine was going to be the big deal, but now we're finding out that it's pretty hard to get it distributed and get it into people's arms as well. How do we fix it? Where are the bottlenecks? How do we fix it?
Well, first of all, we have to understand that the challenge we have right now should have been expected. You know, I've been talking about the last mile and the last inch for a better part of several months. And what we did is we invested a great deal of money in the basic research and development, the licensing approval, the actual of manufacturing of the vaccine, but we forgot about what will it take to actually get this vaccine into people's arms. Right now, remember, we're at the very earliest stages, primarily long-term care facilities and healthcare workers. Long-term care facilities are being handled by a private pharmaceutical or pharmacy company, and they were not really ready to go. Healthcare workers have been slow in getting the vaccine to because they're also in the middle of a crisis. And so to try to do both vaccination and care for all these patients has been a challenge. I think, though, however, as much as that has been a problem, where I'm very concerned is that there's been a real lack of resources to state and local health departments who will be responsible for vaccinating largely all the rest of the population. And if we don't see that kind of change soon in terms of resources coming to these departments to actually hire vaccinators, to hire the kind of people who can actually do the registration work to make sure that people know where to go, when to go, somewhere to get their vaccine, this problem could get only worse. I'm optimistic that the Biden-Harris administration sees us. They're going to inherit a real problem on January 20th. We can't assume it's going to get fixed overnight, but I'm optimistic they do get the challenge here and are going to do what it takes to improve on the vaccine delivery.
Shepard Smith here. Thanks for watching CNBC on YouTube.